Good evening and welcome to tonight's Medtronic Diabetes webinar on Growing Up with Diabetes, a Guide for Parents. My name is Dan Kanakis. I'm a part of the marketing team here at Medtronic Diabetes Australia, and I'll be your host for tonight. Joining us are our two guest speakers. From the patient perspective, Brent Salzman, and from an HCP, from an HCP perspective, Karen Shan. Just a quick reminder before we get started, if you have any questions, please feel free to reach out to us through our Facebook page, Medtronic Diabetes Oz. We've got a post up there, so if you've got any questions during the webinar, please feel free to post them there. You can also reach us on Twitter through the hashtag 640G webinar. Okay, so now I'll just introduce our guest speakers tonight. As I said before, our HCP guest speaker is Karen Shan. She's a credentialed diabetes educator, currently working as a CDE at T1D Partnership in her private practice. Formerly practicing at the Royal Children's Hospital for 8 years. She did her first diabetes education plan, in 1985. Welcome, Karen.
Hello.
Okay, over to our patient speaker, Brent. Brent was diagnosed with type 1 diabetes at 18 months old, has grown up knowing no difference. When he was 5 years old, his parents sat him down and explained to him that he did have type 1 diabetes. After turning 10 years old, Brent began to explore more about type 1 and the implications. Thank you for joining us tonight, Brent.
Hello.
Okay, look, I'll jump into the first question here. This one's for you, Brent. So, how did you find out that you had diabetes, and what do you feel from your experience is essential information when letting someone know that they have diabetes?
Well, as you said, I was diagnosed when I was 18 years old, so I sort of grew up not knowing any difference. It was about the age of 5 that my parents sat me down because I was always curious as to why I was the only one that had to prick my finger and give injections. And they sort of sat me down and told me that I did have type 1 diabetes and what it meant for me at that point. But I feel that the most essential information is that it's not a death sentence. You can move on, do whatever you want. There's no limitations to it. I'm just about to finish my nursing degree, so that's absolute proof that you don't have to put anything on hold.
Okay, guys, sorry about that. We just had a bit of a technical issue on our end. Over to you, Karen. So what do you see is the most common way to let someone know that they have diabetes? And more on that, what information is important to include when letting someone know?
Well, the most common way that people usually find out that their child has diabetes is by taking them to the GP because they are bedwetting or generally unwell with tiredness and drinking a lot of the normal signs and symptoms. A GP will usually do a finger prick and then send the child off to a local endocrinologist, pediatric endocrinologist hopefully, to have the education that they require and the management that they require. When Brent said that the most important thing for him was knowing that he wasn't going, that children with diabetes don't die, it's one of the things that I usually say, that your child is the same person today as they were yesterday. The fact that they've got a diagnosis of diabetes doesn't make them a different person. I also ask them to work with their team. Now that's a health professional team, but also the family and the friends and the peer groups for support, advice and guidance to get them through, especially the first years of having their child diagnosed with diabetes. And that there is very little that diabetes can stop somebody from doing unless they let it. My mum has had type 1 diabetes all of her life. She had 3 beautiful children, of course, I'm one of them, and she was a PE teacher. So it's manageable. However, it's manageable eventually. So there is a road to travel, with the diabetes, but there's nothing that it can stop you from doing.
Right. Thank you very much for that, Karen. Guys, just another quick reminder out there, if you do want to post a question in real time, please feel free to do so on our Facebook page. That's Medtronic Diabetes Oz. We've got a post up there, so please do post on there and we'll try and fit the question in towards the end, and on Twitter for the hashtag 640G webinar. Okay, next question for you, Brent. After learning you had diabetes, what were the biggest concerns for you and your parents?
Well, at the age of 5, my only concern was, yep, so what? I've got this magical thing that's popped up. But my parents' biggest concerns was back then, would I be able to still do everything that a normal child can do? Obviously, they thought about me and my future, and they thought, oh, what about the complications? Will that stop me? Will I be stopped doing certain careers? But obviously, that's not the big issue anymore.
Right. Thank you very much for that, Brent. Karen, over to you. So, at diagnosis, what do you see are the most concerning issues for parents and children?
Well, we'll talk about the parents first. Often they are concerned about the here and now first, so the safety at home. How will they ever learn everything that they need to learn to keep their child safe? And then 2-3 days after diagnosis, after they've been discharged from hospital, we ask them to send their child to school, where that teacher has had very little education in diabetes management, so they're concerned about that, so those concerns. Parents often are concerned about how, as Brent said, how their child is going to be normal, how they can do the sport, the dancing, all the things that they did before. How will that child ever learn to do their own management, their finger pricks and their injections, etc. So once they've got over that initial, how are we going to deal with now and keeping our child safe, they're concerned about the complications for the future, and also in the future, how will their child live independently? How can they possibly live away from home and all that sort of thing when he's got or she's got this humongous disease that we have to deal with? So in the initial time, it's very difficult for a parent to see how it all fits into place with that child. For the children, that's very dependent on age. Some kids think they still have the lollies, and of course they can. But it depends on how much and when. That they often feel that they don't want to do finger pricks because the finger pricks can sometimes be more painful than the injections. Why can't I just eat what I want when I want without having to think about it? We talk about diabetes being for forever, and forever is a heck of a long time. But also, again, with age, it's I just want to be normal. What will other people think of me? Why am I different? And lastly, often children do not get the concept of why their parents are upset with a diagnosis, and often parents are upset and have tears, and so it's explained to children why that is happening. So it's all those sorts of psychological issues that you have to address when somebody's newly diagnosed.
Right, thank you very much for that, Karen. Okay, Brent, next question for you. As you were growing up, did you find there were certain issues with helicopter parenting, and did the pump help overcome these issues?
Personally, I definitely felt that was my parents were always anxious, especially when I was much younger, about everyday things. How would I go at school? Would I make it back at the end of the day? Would my blood sugar drop and no one would know what to do? And just constantly worrying about my future, I guess, as well. They were always constantly checking, have I done my injections? Have I checked my blood sugar? But I definitely feel that going onto the pump, there is a reduced anxiety from my parents. They definitely, from the first week or so of pumping, there was definitely a lot of more control brought onto me and a bit of freedom, I guess. And they're definitely not worried as much now about me dropping low, or because the pump provides pretty consistent blood sugars for me.
Right. Thank you very much for that, Brent. Karen, over to you. This question was submitted by on our registration form. So I'm concerned about being anxious with my child's diabetes. Have you found using an insulin pump lessens parents' concerns?
Well, I had one 15-year-old girl who asked me to speak to her mum because her mum was banging on the bathroom door after she'd been in there for 20 minutes. And she said, I'm a 15-year-old girl. Can you tell mum that I'm allowed to be in the bathroom for longer than that? So there are some parents who are extremely anxious about their child's well-being when they have diabetes. So it's important to remember when we're talking about parental anxiety to educate parents about how they word their anxiety, asking a child about how their day was rather than asking what their lunch blood glucose level was. Now on a pump, you can download a pump and see what that blood glucose level was, see whether that child has given insulin for the carbohydrates. So you don't have to actually ask and be that over-anxious parent to the child. So it's not giving the child the third degree about how their day went. You can have a look as a parent how that actually did go. Does it help reduce concerns? Sometimes it can, because it can make the blood glucose level steadier, and that's what reduces concerns. However, for some children, adolescents more so, it actually gives the parents more information than those children would possibly want them to have, because they can see that they miss that carbohydrate at lunchtime. So it's information that those parents can have to guide their children, is how we try and word the information that they get from a pump, and therefore reduce their anxiety that their child is going to have problems long term because they're not managing well. So it is a way of delivering, only a way of delivering insulin, so it doesn't remove all concerns, but it can reduce them, especially if the levels are steadier.
Right, thank you very much for that, Karen. Look, just a reminder to everyone out there that's watching, if you do have any questions while we're talking, please feel free to post them on our Facebook page, Medtronic Diabetes Oz, or reach out to us again through the 640G webinar hashtag on Twitter. Okay, our next question over to you, Brent. So how did you find the process of moving from pens onto a pump?
In terms of the logistics, it was quite easy actually. I took my concerns to my endocrinologist. I said, look, I really want to try insulin pump therapy. Completely agreed. We went through, put the paperwork in. I got a call from Medtronic. They were pretty great the entire way through. Had education on how to use the pump, carb counting, what to do in case of anything happens. And yeah, the whole process was pretty smooth. On the day, I just basically put the pump on and felt this sort of freedom. Because, yeah, and I didn't really have that anxiety of being attached to anything, because I saw it more of a freedom away from injections and a sort of new life.
Apologies, guys, just had a few more technical issues there. This question's for you, Karen. Do you find most of your patients adapt to using a pump quickly? And if not, how do you help to overcome this?
So yes, most people do actually adapt very quickly to using a pump. However, I have to confess that children are quicker than adults usually, because we live in a technological age nowadays. However, I had a 73-year-old patient who was newly diagnosed and went onto a pump within a month, and her only concern was whether she could do her golf swing. But for people who have been diagnosed for a number of years, often the part of going onto a pump is unlearning self-management. So the things that have been habits for a number of years, such as the way that we treat a hypo, may be different on a pump, or insulin-free carbs, so that 15 grams of carbohydrates that you have a snack before you have to give another injection, that sort of thing. It's no longer the case on a pump. So it's unlearning can be the hard part. However, if somebody is having difficulty in adapting, there's the support publications from each of the companies, pictorial if you're having to recite a canyon and you find that aspect difficult. There's the easy to follow guides. I do my own documentation, reminding people about how to use dual waves and what their settings are, and sick day management. When I start somebody on the pump, I do 2 weeks of daily contact. Now, with adolescents, that's often a text message, because that's how adolescents communicate. But if it's a parent, then it's daily phone call, because that's how adults communicate. Regular face-to-face contact is required. So it depends on the people that are going onto the pump, but there's always that support there. And sooner than most people believe, that adaptation onto a pump and a new way of delivering insulin it becomes second nature very, very quickly.
Right. Thank you very much for that, Karen. Brent, over to you, mate. So how have you found the process of becoming aware of your diabetes from when you were a child to current day?
I found it quite easy, but I think that really comes straight down to having my team there for anything or any questions I had. I have a solid team of my GP, my endocrinologist, and my educator. I've had them since my birth, so having that solid team that provided me the information relevant through, like, age-relevant information definitely helped. It even when I went into my adolescence, I even got a full re-education into diabetes, and obviously when I went on to my pump, I was given a re-education, again, breaking those bad habits from injection, well, not quite bad habits, but again, treating hypos differently. So yeah, the process was quite easy, simply because I had that support network there willing to help me, and through every stage. I had constant contact as well throughout my entire pump start. Had my GP call me, had my educator call me, my endo call me, and even the pump rep called me to make sure everything was going perfectly. So I felt that the entire process was fantastic.
Right. Thank you very much for that, Brent. Karen, back over to you. So I'm a parent of a 6-year-old type 1. Of a 6-year-old with type 1, sorry. I want to educate my child about the impacts of poor management as much as possible without scaring them. How have you seen this done before?
Okay, well, I believe that a child of 6 is too young to understand about long-term complications. Heck, when I was 6, 18 was old. And when I was 18, 40 was retirement age, and 50 you should be put into a nursing home because you obviously couldn't care for yourself. Now that I'm that age, I obviously need to let you know that I'm doing okay with my self-cares. So a 6-year-old hasn't got that concept of long-term. What I suggest that we educate 6-year-olds is about healthy lifestyle, general health and well-being. Getting them to play sport and pointing out that that sport will help them in the future with their diabetes is good. It's telling them how to manage as opposed to telling them about the complications. Talking about food being energy, that food helps repair the body. For example, if they've got a cut knee, it helps the brain work, and that they need to be able to use that food, and that their insulin is helping them to do that. So it's talking about the positives more so than the negatives for that age group. So health and well-being rather than complications. And there's a lot on television at the moment about health, and we see the programs that are trying to improve people's health. With teenagers, if we turn it to a teenager and try and show them with complications, it has one of two effects often. One would be for that teenager to say, well, if that's going to happen, I may as well live life to the full and do whatever I want anyway. Or a teenager will often think that they're invincible and that it's not going to happen to them. So it's not necessarily showing them somebody with complications, but helping them to be healthy that is the best way. And talking about everybody's own normal, so that the adolescent or the child is no different to somebody else because they have diabetes. I talk about an organ on me that doesn't work and that you can see it as plain as day, and it's my eyes. I wear glasses all the time. I'm as blind as a bat without my glasses, and that's my organ that doesn't work. And on children with diabetes, it's their pancreas as their organ that doesn't work. It's just that we can't see it as obviously. So it's all about turning around the way that we educate, as opposed to bringing out about complications, because hopefully we're going to reduce their risk by helping them be healthy.
Thank you very much for that, Karen. That's a really great approach. Guys, just a quick reminder to everyone out there, if you have any questions that have come up, please feel free to post them on our Facebook page, Medtronic Diabetes Oz, or reach out to us again through the hashtag 640G webinar. Okay, next question over to you, Brent. How many severe hypo events do you get now?
To put it bluntly, I've been pumping for nearly 6 years now, and I've had absolutely no severe hypos at all. When I was before pumping and I was on multiple daily injections, I would have about 1 to 2 a year, so it's definitely got rid of those major hypos for me. But in terms of even just normal everyday hypos, I've noticed they've been reduced. As I went to pump therapy, it sort of went down from 4 to 5 times a week down to 2 to 3. When I started using the continuous glucose monitor, I was more aware, so it went down to maybe once a week or twice a week. And now with all the SmartGuard technology that's available, it almost all my hypos are avoided nearly.
Right, that's great to hear, Brent. Thank you very much for that. Karen, over to you. Have you noticed any significant difference in hypos between MDI and pump therapy? So in terms of severity.
Okay, so a pump is just another way of delivering insulin. So the general rules of delivering insulin apply to pump and MDI. You give more insulin than you're going to eat. Food, carbohydrates, you will hypo. So obviously the general rules still apply, but on a pump, the things that can be controlled, such as basal rates given in such tiny amounts as required and varied through the day so that it meets physiological needs, reduce the risks of hypos. It's easier to prevent a hypo, for example, with sport, because you can put temporary basal rates on beforehand, you can run them for a long time afterwards, and that helps prevent the hypos. And as Brent said, the other technology, such as CGM's continuous glucose monitoring, and the SmartGuard technology that Medtronic have, obviously that technology helps with the reduction of hypos. We turn insulin off, we stop giving insulin, so it helps reduce the severity of hypos. So because of those factors that a pump can give the different delivery of insulin, that helps prevent the hypos. So yes, in an easy answer.
All right, thank you very much for that, Karen. Okay, now back over to you, Brent. What would you say is the best advantage to using your pump over other therapies?
I think Karen sort of already knocked that in the head, saying about how on pump therapy you are not locked into your long-acting insulin, and you've got those constant variable rates of insulin throughout the day to match your body's needs, and you are able to make changes on the fly that are able to come in effect in a couple of hours, rather than having to, say, if you do sports, having to eat carbohydrates before to bring your blood sugar up, whereas you can set temporary basal rates to reduce your insulin, and so there's no need for those basically chasing the blood sugars and feeding, that I have found anyway.
Right. Thank you very much for that, Brent. Back over to you, Karen. So what would you say to parents who have a newly diagnosed child regarding insulin pump therapy?
So I talk about the physiologically sound way of delivering insulin, as we said before, with the small amounts of basal rate that can be changed to meet somebody's circadian rhythm, the way that their body produces hormones, etc. I talk about the flexibility. So the flexibility of having a pump means that you can eat what you want when you want within a healthy diet. It means that if you've got a fussy young child, or a 2-year-old, for example, who you don't know how much they are going to eat, and they sit down and they say they've finished, so you give the insulin for that, and then 5 minutes later they're hungry again. If they're on MDI, you don't give them their insulin for the first lot of food and then give them insulin again because they're hungry again. So with a pump, you can do exactly that. You can cover all of the carbohydrates. And I say about a fussy 2-year-old, or a 2-year-old that doesn't know how much they eat. I've had teenagers, and my teenage boy stands at the cupboard and says he's hungry, and he could breathe in and empty the cupboard. He would eat that much, but he'd eat it gradually over 3 hours. And so giving a small amount of insulin every time he puts something in his mouth would be a fantastic way. It's easier, it was said about newly diagnosed, it's easier to learn pump use from the beginning. You don't have to unlearn anything. And I actually have one endocrinologist, pediatric endocrinologist that I work with, and in his private practice, he will only start newly diagnosed on pumps. This new technology that we have is a very sound way of managing diabetes and will reduce complications. So, you know, it's the way forward, and it's only going to improve as time comes along with new technology. So that's what I say to newly diagnosed patients and their parents.
Right, thank you very much for that, Karen. Okay, back over to you, Brent. What would be your one piece of advice to someone thinking about making the switch to an insulin pump?
It would definitely be not to hesitate, just jump in and try it, because for me personally, it's definitely changed my life. I finally got my A1C under 7% for the first time since I've been diagnosed. It's always been much higher than that. So that pump therapy brought that flexibility to me, and I was able to bring my control finally into that tight range.
Right, thank you very much for that, Brent. Okay, guys, that's it for tonight. I just want to say thank you to our two guest speakers for providing some really great insights into what I hope everyone out there has found quite beneficial. So thank you guys for joining us.
You're welcome.
No worries.
Lovely. Okay, guys, just a reminder, if anyone out there would like to find out more about insulin pump therapy, please don't hesitate to reach out to us. We've got a great team here at Medtronic Diabetes Australia. You can reach out to us through our helpline on 1800 777 808 or via our Facebook page on Medtronic Diabetes Oz. We've got a team there pretty much around the clock, ready to respond to anything you've got on Facebook and on the 24/7 Global Helpline. Okay, guys, thank you for joining us and have a great evening.